right, well, good afternoon, everyone. A couple tough acts to follow, but on the positive side, very nice review of the evidence that I think puts me hopefully in a good position to talk about a new strategy for addressing access to guns, and really in keeping with the point of this conversation about point of access interventions. So what I've been asked to talk about today is a new law that is going to be in place very soon in California that has to do with a gun violence restraining order. California Governor Jerry Brown, who's pictured here in his official state portrait, signed the law into effect on September 30th of this year. So this is less than 3 months old that we're here talking about this law, which is very exciting and very timely. But I'm guessing that not everybody has heard about this law yet, so that is one of my tasks here today, is to talk about what exactly does this new California law do. So the California law allows for California to put into place the nation's first gun violence restraining order. And what the gun violence restraining order is it's really a tool that allows family members and law enforcement to initiate a process whereby guns can be removed from people that they identify as engaging in risky behavior, as people who they identify, their family, their loved ones, who are doing things that have put them on a trajectory of dangerousness, and they want to intervene. The gun violence restraining order is a tool for intervening in a way that will hopefully be quite productive. The California Gun Violence Restraining Order allows immediate family members and some intimate partners, as well as law enforcement, to petition civil court and ask for the court's help in intervening, again, in a situation in which a loved one is behaving in a way that's causing them concern. So this is a tool that family members can use when they see a loved one is in crisis, be it a crisis that they're concerned about suicide, a crisis that they're concerned they may harm someone else. But it's an opportunity to allow family members to access the court in a way that would allow them to ask the court to do two things. One is that the court would allow law enforcement to remove guns from anyone that they determined should be subject to a gun violence restraining order for a temporary period of time. And the second thing that this gun violence restraining order would do, if granted, is it would allow the court to prohibit respondents to a gun violence restraining order from purchasing new guns. So those are the two authorities that this new law would allow the court to engage in once the law goes into effect. So this gun violence restraining order happens through a two-stage process. So a family member who is concerned about their son, their uncle, their father, can approach the court, petition the court, and ask, in the absence of the respondent actually, that the court intervene. And if the court determines that there is a risk of threat either to the person's self or to others, the court can decide that to issue a temporary gun violence restraining order for, under California law, up to 21 days. And at that time, the court will also set a date for a second hearing in which the respondent to that order has an opportunity to be present and to state their side of the case as to whether or not they should be able to access guns during this period of time that the court has agreed with the petitioner that that individual may be at increased risk for increased violence. So this is sort of the shell of the gun violence restraining order. It, again, was signed into law less than 3 months ago, and it will go into effect on January 1st of 2016. So we have a little more than a year before this authority is available to people in California. So how did this law come about? So the gun violence restraining order idea was the result of a very thoughtful process that involved many people. Many people who were involved are in this room here today. And it was a process that took place shortly after the Sandy Hook shooting. It was a process that was initiated by Josh Horowitz and the Educational Fund to Stop Gun Violence, to bring together people who work in this area, to bring together scholars, to bring together advocates, to bring together practitioners, really to look at the evidence that was in response to what was increasingly being the response to Sandy Hook, which was that in order to address gun violence in this country, we need to address mental health, and mental health is really the problem. We took a systematic look at the literature and concluded that, as had been said many times before and was reviewed by this forum a few months ago, that mental illness just isn't going to get us very far. That in order to effectively address gun violence in this country, what we really need to be focused on is not so much mental illness diagnoses, but dangerous behaviors. And so the recommendations that the consortium put forth from this process really had to do with recommendations that were focused on risky behaviors, dangerous behaviors, and they came in three forms. So we have one recommendation that focuses on an update of federal law that recommends essentially that existing federal law that has to do with restrictions on gun purchase and possession by people who are involuntarily committed to a inpatient mental health treatment, a very small slice of the mentally ill community, that should stand, and it should be expanded to include people who are involuntarily committed to outpatient mental health treatment as well. We also made a number of recommendations that had to do with these dangerous-based restrictions. So people who are, for instance, convicted of violent misdemeanors are not currently prohibited under federal law from purchasing and possessing guns. So that's a category of people who have been shown in the evidence are at higher risk for committing future violence. Our recommendation is that people focused, or people who have violent misdemeanor convictions, should also be prohibited temporarily from purchasing and possessing guns. But these recommendations, from our perspective, only get us so far. These recommendations really rely on a pretty involved institutional process to be engaged in order for those purchase and possession prohibitions to take place, right? So in order, for instance, to be convicted of a misdemeanor crime of violence, you have to commit the crime, you have to be arrested, you have to go through a court proceeding. And we know that violence happens along a trajectory, and that there are opportunities before those systems are engaged that potentially could be useful in identifying people who are at risk of future violent behavior. So one of the things that the consortium asked itself was really, are there ways that we can intervene on that trajectory of violent behavior before we have this formal institutional involvement? Because really the current threshold is pretty high, and even with these new recommendations that we make, there needs to be a pretty high level of institutional engagement. And our perspective is that there are warning signs, there are indications before those institutions are engaged that can be informative and can be a point of intervention. So we asked ourselves that question, can we engage earlier in the process than these current recommendations suggest? And what we decided was that yes, there are opportunities for earlier intervention, and what those opportunities are based on essentially is engaging members of the community, is not to sort of rely on the formal institutions, but rather to look to family members who are often sort of the first-hand witnesses when people are in crisis, are actually the first people who see when their loved ones are heading down a path of dangerousness. And that really was the genesis of the gun violence restraining order idea. And this is the detail of the three kind of recommendations that fall within that gun violence restraining order recommendation. But I want to assure the audience here, because the focus here really is on the value of evidence to making decisions about gun violence prevention, I want to assure you that there is good evidence to suggest that this is a promising idea. And the two areas that we looked at to inform this conversation about a gun violence restraining order were first and foremost, as Andy suggested, the domestic violence restraining orders, which exist in all 50 states in this country, which have been in place for decades, and which are viewed pretty much universally as a fundamental piece of how we respond to domestic violence or intimate partner violence in this country. And as Andy said, from the studies that we have, when we look at the gun restrictions on domestic violence restraining orders, what we see are some pretty impressive evidence with regard to the associations between those laws that prohibit purchase and possession of guns by people who are subject to domestic violence restraining orders and rates of homicide, intimate partner violence, homicide in general, and intimate partner gun violence homicide in particular. Statistically significant, impressive declines associated with these laws. So that's good news. We also have experience from 3 states in which Connecticut, Indiana, and now Texas that have put into place laws that allow law enforcement to intervene and remove guns when they encounter a person who is acting in a way that's dangerous. So we looked at both the experience of these state laws that have to do with law enforcement authority to remove guns for people who are behaving dangerously, as well as our long history with domestic violence restraining orders to inform this idea of a gun violence restraining order that would put those same principles into place, open up the courts to civilians who are sort of the first-hand witnesses to people who are behaving dangerously in a community, and allow them to put their case before the court in a way that the court can constructively act and remove guns temporarily from people who their loved ones are concerned about the ways in which they're acting. So this is the essence of the gun violence restraining order. There's a couple of issues that I'd like to just call to the attention of the group here that are important to consider as we move forward with the law in California and possibly the law in other states around the country. And one is that while our group came together around a mass shooting that took place in this country, and while I do believe that there is potential for the gun violence restraining order to be an effective tool for intervening in these situations, I think the greatest potential for this kind of point of access intervention really has to do with the type of gun deaths that we've been talking about in the past hour. So really this is a tool that I see as has incredible potential to address suicide risk, right? So if we talk about family members who have access or sort of the first-hand witnesses to their loved ones as they're in crisis, having this tool available when someone is at suicide risk has great potential in my opinion. We also need to think moving forward about who are the authorized petitioners. So our recommendations, as well as the California law, really put this authority into the hands of immediate family members, intimate partners, and law enforcement. But since discussion of the gun violence restraining order has come about, we've had a number of conversations with physicians, for instance, who are interested in also having this authority. So who should be authorized petitioners? Who should be able to approach the court and request that a gun violence restraining order be part of what the court considers is a matter for discussion for our society? Again, as we sort of come out publicly with this idea and engage in conversations around with communities around the country, another thing that comes up is, are people going to be liable for not taking out a gun violence restraining order if a family member goes on to commit harm? Those are considerations that we need to be assured are adequately included in the law so that professionals, family members are adequately protected for not acting and even for acting as well. And finally, I'll just end with the very important aspect of implementation. So as we move forward with the California law, there really needs to be attention to how this law is implemented, making sure that communities are aware of this new tool that exists, making sure that the bench is adequately educated about the circumstances in which this can be used, making sure that law enforcement is aware and on board, because implementation is really where the policy comes alive and the real potential exists to really make a big difference. And I'll emphasize this just by noting that the impressive reductions in intimate partner homicide and intimate partner gun homicide in particular that Andy cited as that are available in the evaluation literature likely reflect effects that are realized only from the purchase side of things. That as far as we can tell, this is not a result of possession restrictions. So I think that there's great potential to have a real impact on gun homicides, on gun suicides in particular, with gun violence restraining orders. And I'm very excited to be here talking about it today. Thank you.